As the coronavirus continues to make the news, a host of myths and misinformation has surrounded the topic. In this special video, we will address some of these myths and conspiracies. Exposing yourself to sun or temperatures higher than 25 degrees centigrade does not prevent the coronavirus disease. You can catch COVID-19 no matter how sunny or hot the weather is. Countries with hot weather have reported cases of COVID-19. To protect yourself, make sure you clean your hands frequently and thoroughly, and avoid touching your eyes, mouth, and nose. You can recover from the coronavirus disease. Catching the new coronavirus does not mean you will have it for life. Most of the people who catch COVID-19 can recover and eliminate the virus from their bodies. If you catch the disease, make sure you treat your symptoms. If you have cough, fever, and difficulty breathing, seek medical care early, but call your health facility by telephone first. Most patients recover thanks to supportive care. Being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from the coronavirus disease or any other lung diseases. The most common symptom of coronavirus are dry cough, tiredness, and fever. Some people may develop more severe forms of the disease, such as pneumonia. The best way to confirm if you have the virus-producing coronavirus disease is with a laboratory test. You cannot confirm it with these breathing exercises, which can even be dangerous. Drinking alcohol does not protect you against COVID-19 and can be dangerous. Frequent or excessive alcohol consumption can increase your risk of health problems. COVID-19 virus can be transmitted in areas with hot and humid climates. From the evidence so far, the COVID-19 virus can be transmitted in all areas, including areas with hot and humid weather. Regardless of climate, adopt protective measures if you live in or travel to areas reporting COVID-19. The best way to protect yourself against COVID-19 is by frequently cleaning your hands. By doing this, you eliminate viruses that may be on your hands and avoid infection that could occur by then touching your eyes, mouth, and nose. Cold weather and snow cannot kill the new coronavirus. There is no reason to believe that cold weather can kill the new coronavirus or other diseases. The normal human body temperature remains around 36.5 to 37 regardless of the external temperature or weather. The most effective way to protect yourself against the new coronavirus is by frequently cleaning your hands with alcohol-based hand rub or washing them with soap and water. Taking a hot bath does not prevent the new coronavirus disease. Taking a hot bath will not prevent you from catching COVID-19. Your normal body temperature remains around 36.5 to 37 regardless of the temperature of your bath or shower. Actually, taking a hot bath with extremely hot water can be harmful as it can burn you. The best way to protect yourself against COVID-19 is by frequently cleaning your hands. By doing this, you will eliminate viruses that may be on your hands and avoid infections that could occur by then touching your eyes, mouth, and nose. The new coronavirus cannot be transmitted through mosquito bites. To date, there has been no information nor evidence to suggest that the new coronavirus could be transmitted by mosquitoes. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs, sneezes, or through droplets of saliva or discharge from the nose. To protect yourself, clean your hands frequently with an alcohol-based hand rub or wash them with soap or water. Also, avoid close contact with anyone who is coughing or sneezing. Hand dryers are not effective in killing the new coronavirus. To protect yourself against the new coronavirus, you should frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are cleaned, you should dry them thoroughly by using paper towels or warm air dryer. Ultraviolet disinfection lamp cannot kill the new coronavirus. UV lamps should not be used to sterilize hands or other areas of skin, as UV radiation can cause skin irritation. Thermal scanners are effective in detecting people who have developed a fever because of infection with the new coronavirus. However, they cannot detect people who are infected but are not yet sick with fever. This is because it takes between 2 and 10 days before people who are infected become sick and develop a fever. Spraying alcohol or chlorine all over your body cannot kill the new coronavirus that has entered your body. Spraying such substances can be harmful to clothes or mucous membranes. Be aware that both alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendations. Vaccines against pneumonia do not provide protection against the new coronavirus. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine against it, and WHO is supporting their efforts. Although these vaccines are not effective against coronavirus, vaccination against respiratory illness is highly recommended to protect your health. Regularly rinsing your nose with saline cannot help prevent infections with the new coronavirus. There is no evidence that regularly rinsing the nose with saline has protected people from the infection with the new coronavirus. There is some limited evidence that regularly rinsing your nose with saline can help people recover more quickly from the common cold. However, regularly rinsing the nose has not been shown to prevent respiratory infection. Eating garlic cannot help prevent infection with the new coronavirus. Garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. The new coronavirus not only affects older people, and younger people are also susceptible. People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions appear to be more vulnerable to becoming severely ill with the virus. WHO advises people of all ages to take steps to protect themselves from the virus, for example by following good hand hygiene and good respiratory hygiene. Antibiotics do not work against viruses, but are effective only against bacteria. The new coronavirus is a virus, and therefore antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for new coronavirus disease, you may receive antibiotics because bacterial co-infection is possible. To date, there is no specific medicine recommended to prevent or treat the new coronavirus. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. WHO is helping to accelerate research and development efforts with a range of partners. Friends, if you like the video, please give it a thumbs up, share it with your friends and family for more awareness. Subscribe my channel and hit the bell icon so that I can reach you with more interesting videos.